Good morning, everybody. So I have to behave because Dr. Carpati is sitting right next to me here. Anyway, thank you, Dr. Mechanic. I had the good fortune of being able to see your talk beforehand, so I got a chance to really kind of absorb it, and I really appreciate everything that you said, and it really does paint a full picture of kind of where we've been and where we're headed. And so my focus is how do we infuse a quote recovery orientation within all of this. And a couple just observations, challenges, perspectives that I just wanted to note. You talked a lot about the issues around medications and pharmaceuticals and the inappropriate prescribing, and we know there's a lot of complexities with that. So I had mentioned this before in another talk, but I just think it's so critical. And this came from a study from the British Journal of Psychiatry, 2012. And I think it speaks to a lot of what you mentioned, which is evidence regarding overestimation of the efficacy of antipsychotics and underestimation of their toxicity, as well as emerging data regarding alternative treatment options, suggests it may be time to introduce patient choice and reconsider whether everyone who meets the criteria for a schizophrenia spectrum diagnosis requires antipsychotics in order to recover. The whole issues around medication is very controversial. You also mentioned the whole issue of overprescribing pharmaceuticals for kids. So I just think it's something that we have to be very attentive to, and I know more and more of us are. So thank you for mentioning that. In addition, I totally agree with what you said about good treatment for people includes more than pharmaceuticals, and I know that Dr. Carpati mentioned that as well. But I just want to add a couple more things. I think that the focus on wellness interventions, SAMHSA has the 8 dimensions of wellness, again, looking at people from a holistic perspective. Peer and family support, really continuing to support that in this new world that we're in. As Dr. Carpati mentioned, alternatives to hospitals, whether it be the parachute program, which thanks to Dr. Carpati's leadership we now have in New York City, which includes enhanced mobile teams, the respites, as well as the support line, the peer-run support line, whatever we can do to expand that in this new environment. Linkages to both primary and specialty care, and the use of peer health navigators, which is a whole new thing you all will be hearing about soon. Also, open access to antipsychotic medications, and something we call medication optimization, which is about prescribing just the amount that people need, no more, no less. Also, you mentioned about most care is provided in outpatient settings, which is a good thing. But I just want to note that if we look at the system, we just want to make sure that it's not hospital-based, that it's not symptom-based in our current system, that it takes, it's just something to be mindful, that we don't turn our outpatient system into a very sort of medically model, clinical-based system. And then ensuring access to care. That's something that we can all agree with, that this is a challenge, and there's reasons why it's hard sometimes to access care. Most of you all know all the reasons, but sometimes people are really uncomfortable with existing care. If it was that easy, we wouldn't be where we are today. And so thinking of different creative ways to make sure that we match the appropriate supports with what people really want. So I think that's really important to think about. And then around medical necessity, we talk about that a lot. And I think that we really need to be more creative around medical necessity. And we talked about consumer-directed spending and the whole issue of, if I'm a person who, let's say, really wants to work, and I no longer maybe need to see my psychiatrist and therapist every month, but I need money for a car to get to work or license, like to think more about flexibility around that. And then the whole issue around education and rights, a lot of people are pretty clueless about what's going on right now. I mean, you all live and breathe this every day, but most people, whether it be families or individuals, are really not that clear about what's happening. So whatever we can do around educating people around what's going on and how it's going to affect them personally and around their rights. Hopefully the Medicaid Managed Care Ombuds program will protect individual rights, but we have to keep an eye on those things. And so good news is that, yes, the system is changing, and that's a good thing, and it's changing quickly. I don't know if that's a good thing or a bad thing, but I'm sure that's a mixed bag. And that, yes, we are looking beyond symptoms. That's a great thing. Not to say that we can't look at those things, but we're not just focusing on those. And that we're focusing on physical health in a way we never have before, and employment and housing and all those things that really matter in people's lives. And and also just one other thing that I just want to mention in addition to parachute, which of course I'm excited by, but also My Psyches, which the city and the state have been working closely together in expanding something called My Psyches, which was developed by Pat Deegan, and is an opportunity for consumers to really take a much more interactive way. It's a web-based tool, and so that let's say I'm going to see Dr. Cedric. I'm looking at it right now, and he's a doctor. So I'm going to see you, and instead of me coming in babbling and being all over the place, I'm going to be very focused because I'm going to have this web-based report, and I'm going to come in very organized, talk about my side effects, what's important in my life, and we're going to have like this 15-minute productive session. So that's My Psyches in a nutshell. But anyway, thank you all very much, and